Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a little bit more about small fiber nerves and the neuropathy that accompanies small fiber nerves. So we talked about the different types of nerve fibers. So let me remind you of peripheral neuropathy and how that presents. If you remember, you got the central nervous system, which is the brain and spinal cord, and you have the somatic nervous system, or the peripheral nervous system, which consists of the somatic nervous system and the autonomic nervous system. In the somatic nervous system, you have three types of nerves: the small fiber sensory nerves, the large fiber sensory nerves, and the motor nerves. In the autonomic nervous system, you have just the autonomic nerves. So when it comes to all of these, let's start with the small fiber neuropathy. With the small fiber neuropathy, you actually have the small nerve fibers that are malfunctioning. These are the unmyelinated fibers, which are the A delta and the C fibers. And a lot of times in the other classification, they're principally going to be fiber type 3. And because of that, you have specific symptoms and specific malfunction that happens in the somatic nervous system and even in the autonomic nervous system. So the autonomic nervous system is also made up of these same fibers, the unmyelinated A delta and C fibers. And we're not going to talk about that much right now, although you do have some significant autonomic and enteric functions or automatic functions that are happening in the body from these type of fibers. So small fiber peripheral neuropathy occurs as these fibers, these unmyelinated fibers, are either malfunctioning because they're damaged, or they can be destroyed. So as opposed to large fiber nerves, small fiber nerves can actually completely be destroyed. When we do an epidermal nerve fiber density test, we actually notice that the nerves are not just damaged, although that sometimes is shown in that test, but they are absent. They're counting the number of nerves, and what they're finding is that these nerves are absent. The good news is also opposed to large fiber nerves, is that we can actually show regrowth, we can show repair, and we can show them recovering. Whereas the large fiber nerve, if you cut a large fiber nerve, if you cut the spinal cord, we do not yet have a solution to cause it to regrow and to repair. So that being said, the small fiber nerves can recover. Now, this also presents as a problem because you have a lot of individuals that are actually being diagnosed with a peripheral neuropathy initially, and they're getting a nerve conduction velocity test or an electromyography test, and they're being examined and they're being told, well, actually, these tests came back normal, so you don't have peripheral neuropathy. This is absolutely false. Small fiber neuropathy will not show on either of these two tests. The nerve conduction velocity test is only testing large fiber nerves and large fiber sensory nerves, and the electromyograph is testing the large fiber nerves and the motor nerves. And so in those cases, you're not even getting any indication whether the small fiber nerves are working or not. So that's why we typically will do an epidermal nerve fiber density test, because it's the only way to actually test and see if those small fibers are working like they're supposed to. The other part of this is that the presentation of small fiber neuropathy can present in a wide range of situations. It usually presents, however, in a length-dependent fashion. What does that mean? That basically means the furthest away from the central nervous system is where it's going to start. So small fiber neuropathy typically starts at the tips of the toes and has a stocking type formation. So it's like pulling a sock on, tips the toes, working back up the foot, up the ankle, up the leg. And if it's been around long enough, the condition is more advanced, then you'll actually get a glove formation as well. So it'll start at the tips of the fingers and work its way back. So that's why we say that typically it's a length-dependent fashion that it presents. Often it will also come on gradually, and it will start more as almost like a distraction, where you'll notice the symptoms. You have the symptoms, they're not that severe, and they're progressing over a period of time, and kind of a gradual onset. And they're a lot of times they're going to be distal, like you said, the very tips of the toes, the very tips of the fingers, and working their way back. And it starts, like we said, as basically a distraction. I like to call it a distraction because you're noticing it, but it's not interfering with too much. And then it becomes a discomfort. So you actually have pain and start to get a little bit of the limitations that come from it hurting all the time. And then it progresses to the next step, which is complete disability, where you say, okay, it's completely interfering with my life. Now, that being said, I can't say this without also commenting about the fact that there are some forms of small fiber peripheral neuropathy that does not function in a length-dependent fashion like we just described. In fact, it can happen symptoms to the trunk, to the face, to other focal areas that are not length-dependent, but are just presenting because of the way that those particular nerves, because those are also peripheral nerves, they can also be damaged, they can also be destroyed so that they don't work as well. So as you think about your peripheral neuropathy, as you start saying, okay, do I have peripheral neuropathy? Really, you need to be examined, you need to be evaluated and say, okay, is there a reason for this? The problem with most diagnoses of small fiber peripheral neuropathy is right now about 50% of individuals are being told that they have idiopathic, or we don't know why you have peripheral neuropathy. The reason why is because they're not actually looking at the whole picture. They're not looking deeper. They're not saying, okay, what are the tests we need to run to find what some of the causes are? Because it could be something very, very simple, and you just need to be evaluated, you need to be looked at, and make sure that you're getting the treatment that you deserve so that you can control your peripheral neuropathy as it should be controlled. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 125. Have a great night.